ELCURE Therapy is a little bit complicated. Let me show my PPT. ELCURE Therapy is electrical cure abbreviated the word, and then it use high voltage operating microcurrent treatment application. Its nickname is no-SED therapy. No-SED means no S means no steroid, no surgical operation. A means no analgesics, no opium, and no D is no drugs. So it reads auto-healing by your cells themselves by the aid of electrical cell charging, likewise your cell phone. At first, I'd like to tell you about the cell electricity. Everything is energy. This is not philosophy. This is physics. That means that all the human body comprises matter and energy. That energy is both electrical and chemical. So everything need energy. And we can see the composition of human body where at first they compose atoms, molecules, and molecules, organelles, and cells, and tissue, organ system, organism, and become human. But how many number of cells, how many cells you have? Normally we call it the 60 to 100 trillion cells. Every cell needs energy, and energy means electricity. So electricity is very, very important to survive. So one cell is one universe. You can see the right side, the diagram. There are so many kinds of organelles in the cells. So even though our technology at the moment, in the present technology in the world, cannot make cells in the laboratory. So, about the electricity, every cells working under the base of electricity, and the cell membranes act as an electric condenser. You can see the two layers of one layer is the lipid layer and the hydrophilic and the hydrophobic layer, and between them, the electricity is condensed. So it is collected outside the cell membrane. We call it electric condenser. The cell membrane acts as the battery. And you see by the cell biology testing, -7 to -100 millivoltage is normal cellular voltage. For example, one system, one cell, and then comparing to the heart cell voltage is around from 90 to 100 millivoltage, and then it becomes slowed down about 50%, from 30 to 50 millivoltage. Cellular activity decrease and start to pain and decrease capillary circulation and chronic illness and chronic fatigue, and then it's discharged. The resting membrane potential means electricity, the voltage lower down again, more 15 to 20 millivoltage, it becomes cancer cell. It changes into the cancer cell or cell death. So electricity is very, very important. You can see the heart, you can see the 90 to 100%, 100 millivoltage is fully charged, so there is no cancer in the heart. The another part, for example, the liver, pancreas, spleen, or lung, there are so many cancer, but the heart has no cancer at all. Heart, because the electricity is fully charged, the cancer cell cannot survive there. It's very interesting for electrophysical viewpoint. So action potential is different. There are some kinds of cells, excitable cells, So skeletal muscle cells, if that is contraction and relaxation, and neuron is sending the signals. So it needs action potential This is the theory from the Hodgkin and Andrew and Huxley, it making Nobel Prize in 1963, and then it comes sodium potassium pump makes electricity, so action potential, the stimulus like this. So you can see the cell type, left side, skeletal muscle, neuron, smooth muscle, and the photoreceptor cell, erythrocyte, chondrocyte. You can see erythrocyte, RBC, red blood cell, and chondrocyte is soft bone tissue, cartridge cells. They need no action like that. So you can see the excitability is no, but the another cell, muscle cell, is needed the quite, and then action potential like this, and then send the signal or contraction or relax. So action potential is a little bit another concept, but according to the cell type, action potential is necessary. But in the RBC, red blood cell or cartridge cell did not need. So we have electricity in human body also. How to use in the medical field? We use in the diagnosis of the heart, and then the checked and measuring the electricity. We called as ECG or EKG, electrocardiogram, and then the measuring the electrical activity of the heart. And another one, EEG. EEG is measuring the brain wave, and EMG is measuring the muscle change. And another, now using the impedance meter. Impedance meter is the impedance, likewise resistance, and then it becomes the facial analysis or something like that. Use it. ELCURE will be object pain detector in near future, and then standard pain measuring device. Now we cannot measure the pain objectively at the moment in the medical view, and most of pain detection is subjective. Oh, I'm very pain, something like that. But there is no device. Oh, your pain score is more 25 or 35 or 55, but there is no pain detector objective. But ELCURE can do this. So I hope ELCURE will be the standard pain measurement device, and the doctors love this, use it in near future. Next subject is why sick? Why got ill? As I see the disease in the viewpoint of the electrophysiology. Every disease comes from the cell stress. Cell stress is there are so many factors. Physical factor, over exercise, hard labor, repeated hard work, overall under exercise. Number 2, trauma, accident or surgical operation and sports injury. Metabolic diseases such as hypertension, obesity, diabetes, gout, obesity, hormonal imbalance. And then cancer, circulatory diseases, cardiovascular, angina, myocardial infarct, or degenerative disease such as knee, hip, disc, stenosis, something like that. And inflammatory disease is bacterial, viral, fungal, parasitic. Immunologic disorder is allergy, autoimmune disease. Mental and spiritual is psychosis, neurosis, mental illness. Habitual addiction is alcohol, opium, drug, gambling, or something like that. Environmental is pollution, air pollution, water pollution, radiation, food, GMO foods, noise, electromagnetic, and dust, or genetic disorder, congenital. Every factors is become a cell stress. So cell stress is become, we can get ill easily. So this is diagram which I make is the cell stress is left of proportion, and then if the cell stress started in the cell, mitochondrial dysfunction. Mitochondria is the energy making plant inside the cell, and then mitochondria making ATP. It becomes likewise electricity. Electricity is the function is down, then decrease the cell membrane potential. It means the cell discharged. The voltage is lowered, and the decreased voltage is lowered, and then the action, the gate of the cell, okay, the gate do not open well, and then decrease the microcirculation. There is no much circulation, and then accumulation of lymph sludge. Accumulation is waste product inside the cell, outside the lymph sludge, and then becomes the atmosphere of the cell inside and the outside. There is no shower about 1 month, something like that, 2, 3 months like that. Very dirty, become dirty, and it is easily to get the viral infection, bacterial infection, or fungal infection, and become easily get inflammation. Inflammation makes the tissues very thick and very, very strong, and that means the fibrotic change, and making a taut band, very hard tissue, become hard tissue, and then getting edema, swelling like this. This is vicious cycle. It's every step of vicious cycles happens simultaneously. That is my theory about the electrophysiology. Then you can see the -7 to 100 millivolts is fully charged. It's a normal. And then the 50% down, our body feel pain, and the circulation decreased, and become chronic illness, and then much down, -15 to 20, cancer or cell death. So right side, discharged, disease and pain develops, and left side, charging, then become normal. That is the very, very important thinking way theory about the electrophysiology. Number 3, what is lymph sludge? I think you never heard of the lymph sludge, but I'm majored in the lymphology and doing many lymphedema patients, so many operations and treated, and I developed about 10 methods how to treat, how to manage the lymphedema, because lymphedema is incurable disease. So I'm making a special concept of the lymph sludge. Lymph fluid should be very clear and then very well circulated, but lymph sludge is blocked. So you see, the function of ECF is extracellular fluid is the watery environment, unique composition. So every cell, we are magnify, and then every cell is likewise island in the water, in the very big sea. Then we can communicate with between the water environment. We call it the extracellular fluid, and then become the exchange the ions. Ion means electricity, and then we are doing the energy and the structural metabolism. So that is receive the oxygen, carbon dioxide, receive the oxygen into the cell, and then we discard the carbon dioxide. So we call it respiratory function. And then nutrient, glucose and protein, fatty acid received, and then discard the secret waste product. That means all metabolism are well done by the electrical movement under the in the extracellular fluid. And then the very condensed ECF means lymph inside the lymph vessel system. So lymph is high osmolar proteinous fluid, but lymph sludge means more condensed, more hard, more condensed, very thick concentrated lymph called lymph sludge. That is my concept and idea. So lymph sludge is very important concept, and then I searched about this like this concept in the medical field that called PLEM in Chinese medicine. PLEM, PHLEGM, PLEM, DAM in the Chinese medicine. And then I think this is lymph sludge is condensed high osmolar protein fluid and dehydrated waste product. It becomes very, very thick, gel-like. And then if the water evaporates more, it becomes very, very hard like a stone. So high viscosity, and become high viscosity is thicker is bad because it blocks every information change or metabolism, and then it is very, very dirty product. So it is very easily to get inflamed by bacteria, virus, fungus. So lymph sludge is electrically act as insulating. So there is no cut the electricity, and then it blocks the electricity. So cellular communication is blocked. So this is developed. It's a little bit new concept and never heard about it. Lymph sludge is very, very important, and every cell should communicate easily between cells, and then full of electricity making easier. But the lymph sludge blocked. You can see diagram. And the left side is discharge cell. It's full of waste product, lymph sludge inside the cell and outside the cell. The right side slide, you can see very happy cell is easily communicated, and then the very easily secrete waste product and then receive the nutrient like that. That is a normal cell, and the disease cell is the environment is very bad. If the voltage is lowered, what symptoms or signs developed? There are more than 250 types of cells in human body. If the eye cell, nose cell, lip cell, lung cell, liver cell, or intestinal cell, and or the shoulder cell, or something like bone cell, muscle cell, like that. And then according to the hereditary factor, and then my father was ached from knee joint pain, and then my age is over. When my age is over 60, my knee joint also very bad, like that. It's come a DNA. DNA. I think it's related with the DNA hereditary factor, and then so according to the affected cell type and function, every symptom can develop. The voltage lowered, so we can see so cellular dysfunction come from the discharged cell. So the symptom is depend on the cell type and the cell function. Okay. So symptom of low voltage. The most frequent symptom is acute pain and chronic pain. Pain means, oh, my voltage is low, my cell is discharged. Here pain, oh, my shoulder is discharged. Oh, knee pain, also knee is discharged. Chronic fatigue, oh, I'm very, very fatigued. Like that is generally discharged. And headache, oh, brain cell. Or nausea, or like this is come from another fact. Or insomnia, I cannot sleep very well. That is the lowered voltage cannot making sleep well. And the depression, I'm very depressed. Oh, why? I don't know. That is not good. And this skin trouble, indigestion, or something like that. The pain on the or some like a menstrual pain or something like that, would decrease the mental power and behavioral disorder, no palsy, sensory change. Very various signs and symptoms according to the cell type and function. So if the cells, especially in red blood cell, the electricity down, red blood cells stack together. We call it rural formation. That means that the energy decreased, they are stacked together, keep the energy. But in the full of electricity, right side you see normal, and then red blood cell do not stack. So every human body, when they die, every cell die from the thrombosis in the blood vessel. Okay, so thrombosis means the low electricity. The electrical physiology point of view. Number 4. What is the meaning of the ELCURE? ELCURE is L is electricity, Q is cure. It's a synonym, water regen therapy. Water means high voltage operating microcurrent therapeutic application. So high voltage, 1000 is electrical cell charger is a brand name, and every cells are batteries. Effects of microcurrent therapy. So there are so many medical articles since 150 years. Many good point of view of the microcurrent therapy. So thermal effect is according to the Joule's law, is when I treated microcurrent therapy and it becomes a little bit heat, or chemical effect is the ion redistribution of the ion torisis or something like that is cathode, anode, and the alternative current, and the electromagnetic effect. And the number 4 is very important. Production of ATP increase 500% in mitochondria. That is most important action of the microcurrent therapy. And number 5, increase enzyme activation. Number 6, calcium ion activation is very good for the bone healing. Okay. And then edema absorption. I approached the microcurrent therapy because I studied and then evaluated about the lymphedema therapy. Lymphedema means the lower the microcirculation, bad microcirculation. So I treated and I started to study about the edema. So in making edema. So microcurrent therapy can heal and then promote the edema absorption. And then number 8, bactericidal effect. Bacteria kill the bacteria. Number 9, electrokinetic effect. Electrokinetic effect is like a muscle massage. And then number 10 is pain modulation. Number 11, promote tissue healing. So many articles about the microcurrent therapy. That is about 150 years. So many doctors knows about it.